Hello, everyone. Thank you so much for helping on. My name is Ransom Onyema. I'm a final year radiography student, medical writer, and also a content creator, especially on YouTube. So today I have an amazing guest speaker all the way from the US. Incredible. Her name is Dr. Catherine. Please, Dr. Catherine, could you introduce yourself to the audience?
Hey everyone, I'm Katherine Grill. I'm calling in all the way from LA, and I'm just so excited to be here. I'm trained as a therapist and a neuroscientist, and I really focus on youth mental health.
Amazing. So, Dr. Catherine, thank you so much for introducing yourself, and I believe that the audience have a clue about what you offer and who you are, really. So we have a couple of questions for you to answer. You ready?
I'm ready.
All right. The first question is, how has your background in neuroscience and health research shaped your approach to your mental health? Talk us through.
Yeah, being a scientist and a clinician, I first worked in academia and was working in research, so here in the US, NIH research, and then I transitioned to the industry side and ended up founding my own technology company called Neolth. We built a mobile app for teen mental health and really worked with a lot of other mental health technology providers in the industry. But having that academic and scientific background, I think was key because when you're working on innovation, you want to make cool, new, exciting things that can help break down barriers when it comes to accessing care. But you also need to make sure that they actually work and that they're safe and helpful for people. So for me, I've always prioritized in the science in whatever work I've done, if it's been on the technology side, even the social media side, thinking about evidence based frameworks for how we're talking about mental health online. That's really been a guiding principle of my work.
Amazing. So you made mention about you worked in the dementia department before. Is what you said?
In academia.
Yeah. Is it okay? So how did you transition before I proceed to the next question? What
Yeah.
made you to transition from that role you were in the academia
Yes.
to focus on youth mental health? Why did you transit from that role to youth mental health? I want to know.
Yeah, it was a little bit of a journey. I mean, for me, I was always interested in youth mental health because growing up, I had a lot of family members with serious mental illness, some people who were hospitalized. I unfortunately had quite a few friends, school age friends, who passed away early from preventable kind of mental health struggles. And that's how I became interested in the field. I thought we need to address this. It's a big problem. At first, I trained as a therapist, so I was working like in the hospital, psychiatric units. But in the U.S., it can be a little bit frustrating because the people who get the good care are the people who can afford it and who have insurance. So I was really interested in, okay, how can I increase access to care and make things more equitable? And that's why I went back to school and I got the PhD in neuroscience. It was really focused on, behavioral mental health interventions because I wanted to build and then validate new accessible treatment programs. So for a while, I was working at Children's National. It's a pediatric hospital in Washington, D.C., working in behavioral health there, doing NIH research. So those are the big kind of government funded research trials. And I loved that. But my heart kind of went towards the implementation side, and I wanted to get some of the good work that we were doing out in the community at scale. So ultimately, that's why I decided to transition to industry and moved out to California and got into the tech industry.
Amazing. Wow, that was a very intriguing transition because I know already that it's not an easy transition from that role you were before to another new role. You have to know your whereabouts before you have to fit in and all that. So, Dr. Catherine, thank you so much for talking us through on how your backgrounds, in neuroscience and health research, shaped your approach to your mental health. And thank you also for talking us through about your transition when you were working in the dimension, field in the academia, sorry, before transitioning to, youth mental health expert. Amazing. So the next question for you is, Dr. Catherine, like you mentioned about using tech in terms of your, your health researchings. And so tell me, or tell us rather, what role do you see technology, playing in improving mental health outcomes for young people out there? What do you have to say about that?
Yeah, technology is a really interesting field for me. And social media, I think, falls under that, which is even newer for me. I'm starting to get into social media, but I see it as an entry point to care. So, where we are, there's still many years. Some research says on average 11 years between symptom onset when people start feeling unwell to actually getting effective treatment in the US for mental health care. So, 11 years is a really long time. And you can imagine for young kids, there's a lot that they're going through developmentally, important life milestones. And if they're not doing well, that's a problem. We want to get them help right away. So technology is that kind of on ramp to shortening the time it takes to getting access to care. And one example of that is within the mobile app we built. It's called Neoth. We actually have an AI system that can help flag young people if they're struggling. So a lot of the content, it's self-guided, it's educational, but we did want to have that kind of care escalation component because we thought, well, there's a lot of young people who are going to need care. How do we identify them? So we built up this AI system and it can kind of flag the different texts if young people are journaling, if they're talking about something like, suicide or depression, we can pick up on that. And there was one instance where we were using this here in the US in the schools, and there was a young student who was really struggling with bullying in the school and feeling depressed. And our AI system picked up on that. So on the same day, we were able to notify the school. And it actually turned out that they were thinking about expelling him, so kicking him out of the school because he hadn't been showing up and he had really poor attendance. But of course, he wasn't showing up because he was being bullied and he really didn't feel safe at school. But the school didn't know that. So we were able to connect with them and say, here's what's going on. Here's what our system picked up. They were actually able to then address the bullying and then get him in care with one of their therapists to address the depression and get him back on track for graduation. So that could have been a student who otherwise didn't graduate, didn't get access to care, and the depression got worse. Whereas when we layer in technology, it can really shorten that time for them to access and care and kind of help identify who needs help now.
Hmm. This cat, I'm a bit intrigued. We med students are very intrigued sometimes. You that was an amazing, initiative on that question. And amazing to your team as well and you as well for creating that amazing tool to detect mental health crisis in young people as well, using AI, which is an incredible tech product that could improve the lives of young people as well. So do you think in years to come, do you think that AI is going to take over healthcare providers? Do you think?
I think it's another tool. And keep in mind that what I just shared for you, that was actually part of a research study that we did in partnership with the University of Miami. So we have the mobile app, we have the AI system, but we also have the clinicians and the researchers. So every step of the way, we're not just creating these innovations in AI and technology, but we're testing them and making sure that they're safe. So I think that it's
Hmm.
another tool that can help do things like, as a clinician, I could never keep track of, say, there's 2,000 students in my school and I'm the school psychologist. I could never keep track of them 24/7 and what's going on with them. An AI system can help me. So the AI system is not going to replace that clinician, but it can definitely help them and increase some of the efficiency and reduce their workload.
I do agree. I do agree. If for instance we're using manual settings to, like you said, like 2,000 students, you can't. It's not even. There's no possibility you can keep up to the to the track list of all the students there.
Mm.
If you're using the manual settings, it's not possible. It can never be possible.
Yeah.
We're human. You can get down immediately. So AI is an incredible tool if we if used properly, because it can be a dangerous tool as well. So, Dr.
Exactly.
Cat, before we proceed to the next question, talking about you know determining the behavioral patterns in terms of mental health outcomes in young people. Do you think there are bad effects on using that AI product in decifying mental health outcomes in young people? Do you think there are disadvantages using those AI products?
There can be if they're not safe. I mean, anything in behavioral health, and we know this just from therapy and kind of a more traditional behavioral health treatments, even medication. There can be side effects, right? One of the biggest issues in behavioral health is where there's basically no effect, and if somebody is spending their time and they're using a treatment that's not helpful, that's wasting their time and money, and they could be using something else that's helpful. So that's one of the biggest issues that I see in the mental health field is that there are a majority of the products out there without the science, without the evidence base, and are they even helping people? Some of them might be hurtful, and we've seen that in the case of some mobile apps and some AI systems out there. So that's why it all goes back to bring the science into innovation. Yes, you want to have these new exciting technologies, but you have to have the science and you have to have the clinicians on board. So you're testing them to make sure that they work and that they're safe.
Thank you so much, Dr. Cat, for talking us through about the roles of usage of technology, playing in terms of improving mental health outcomes, especially in young people. Dr. Cat, I have a friend in the UK. Probably you've come across her maybe on LinkedIn or maybe some other places. Her name is Ruby Jackson. She's a UK medical student that created an app, that, in terms of women's mental health,
Mhm.
and she talked about, she's on my channel. If you're interested in watching the video, you can just go over my channel and just check it out.
Mhm.
Um, she talked about, you know, the how the regress phases on how they founded the app, and the major problem is the marketing.
Mhm.
Before we proceed, Dr. Cat, how did you bring these incredible products to the limelight? How did you market it?
It's really quite difficult. I would say that is the biggest challenge. Once you get over that kind of obstacle of making sure that it's safe and that it's evidence based, and you're kind of continuously testing, the implementation, especially here in the US, like that's been a huge problem and a big reason why a lot of companies have been scaling back or even going under in the past couple years. So I don't know that any one person has figured it out. One of the things that we've done when I was at Neolth and building that company is we brought young people who are, that's the user base, on board as ambassadors. We actually built a global program. So we have young people across 20 different countries who get to work with us. They learn from us about things like best practices for content creation or best practices for talking about mental health on social media. Some of them actually create content that we feature, and we feature them in the app. But we really work with them as ambassadors to get the word out. I think that's been incredible. That's been helpful. And we've been leveraging social media a lot as well. It's a newer area. Like I said, for me, I'm new to YouTube. I'm new to Instagram. But one of the things I've been working on in partnership with my friend Kenny Thomas, so he's a retired NBA player, is how can we use social media to promote awareness of these great services. So we actually just got off a live stream. It was so much fun with a doctor who is running mobile health clinics. It's basically like a doctor's office on wheels. But we brought him onto the live stream. Kenny has a big audience. We were just talking about, how does the service work and kind of demystifying it for young people. So I think if they
Mm,
have the opportunity to meet a doctor, to be, on a YouTube or an Instagram live and kind of see the clinic, see how it works, have their questions answered, they're going to feel a lot less nervous about engaging with that service. So definitely there's a way to bring social media and kind of bring conversations like these into the marketing to just help increase awareness of and engagement with these new services.
Amazing, amazing. Thank you so much. Because she also, stated that the marketing phase was a very, very rigorous process. And I'm glad that I told her that you don't need to worry. You just have to do what's needful. Put her own hands on deck to produce a common goal. And now she's winning a lot of awards in the UK. You know,
Amazing.
apps are really helping a lot of women, in terms of mental health and all that. So it's incredible that you're putting such, intriguing, works in terms of improving, young people's, you know, mental health, because there were young peoples out there that feels really adamant in terms of speaking up on what they're passing through in
Mhm.
mental health, and you're kind of like a spokesman for them, you know, being the voice of the voiceless, which is a very that kind of opportunity shouldn't be joked about, because not everybody can come out and say what they're passing through, in terms of mental health outcomes they're faced in their daily lives. But you come into the picture, it's incredible, and I
Thank you.
know that the audience are really enlightened the more about the works you do in the mental health phase as well. So, Dr. Cat, the next question for you is: Can you share a pivotal moment in your career that led you to your current focus on youth mental health? That really got me intrigued in your career thus far, since we've connected on LinkedIn. I was really intrigued that why did you focus on young people's mental health, youth mental health? Why didn't you just focus on, like women's mental health, grown ups mental health, men's mental health, or children's mental health? So tell us, what made you to, focus on that, youth mental health topics here?
Well, being a teenager is really hard. I think we all remember. And I know growing up for me, I didn't have support, I didn't have resources. We didn't talk about it in school. And it was something where I had family members who were struggling. I had a lot of friends who were struggling and ended up dying at young ages. And it was a little bit shocking to me to see things swept under the rug. Like people weren't talking about it. It wasn't like there was, somebody died and then let's change things. It really just felt like people wanted to hush hush. We're not going to talk about it. And the problem was continuing and it was getting worse. So I said, well, we have to stop this. And I don't want to wait until people are at that point of crisis. I want to work with them as early as possible to prevent that. So for me, that idea of prevention and working with kids as young as we can, that's what's so exciting about youth mental health.
Dr. Cat, I tell you something. The reason why you're really, because I'm into research as well. Apart from my studies of radiography, I'm into researching as well. I am a very dangerous person in terms of researching. I was speaking with a clinical psychologist, a few hours in the morning, and she's based in the UK, in the US, sorry. And we're talking about everything one does. There is a story backing him or her up. The reason why you ventured into youth mental health, to what I noticed, is because you faced that in the past.
Mhm.
You've experienced such things, and you don't want young people to experience what you passed through. And that was
Yeah.
amazing. That was amazing that you're trying to like bridge that gap in young people's mental health. Amazing, amazing. It's not easy,
Thank
it's
you.
not easy
Yeah.
at all, because she's told me the clinical. Her name is Latifat. She's a clinical, psychology in the U.S. She told me that people that do drugs, that do incredible things, don't just judge. Like looking at the person, just say, "Hey, this person's a bad person," or this or that. Just hear what the person has to say. Don't judge people by their physical looks without hearing their stories. People seeing you now, they don't know that you've had some battles in the past about youth, about mental health and all that. And I this is what is going to get the audience really curious about that. Your works are really rampant, because the people I see working mental health is either women's mental health or men's mental health. That's all. They don't go deeper into the youth and the kids' mental health. And thank you so much for doing the work you're doing, and wishing you and your team all the best. So we have two
Thank
more
you.
questions for you to go, Dr. Cat.
Okay,
All right. So
I'm
are you
ready.
are you ready for this question? It's kind of like
I
very
am.
very intriguing.
I'm ready.
You ready? Okay.
Man,
All
I
right.
am. I'm
So
excited.
okay. So what are some of the biggest misconceptions about youth mental health that you've encountered in your work?
Oh, one of the bigger misconceptions that I hear about young people is that there's no more stigma when it comes to mental health. I know with older generations, it really wasn't discussed. And it is being discussed, especially after COVID, so much more, which is fantastic. But the reality is that young people still get nervous. I think everybody gets nervous when it's about them. It's about them going to a new doctor or a therapist. They don't know what's going to happen. And that's totally okay. Like we had a young person, for example, we were working with, and they said the scariest day of my life was trying to go to the therapist at school because it was one building on campus and everyone knew that was for the therapist. And I didn't want people to see me. So I put on my hood and I put on my glasses and I was still really afraid. So I would say, if you're feeling like that as a young person, that's okay. It's okay to be afraid. There is still that stigma. But what I do see with young people, why they're so interested in mental health, is they want to help their peers. They're really altruistic. So for the ambassador program, for example, where we work with young people, we often bring them in. They get to talk about mental health. It might not necessarily be their personal stories, but they get to promote mental health in their community, show other people that it's important. And then by kind of starting by just talking about mental health in general, promoting it in their community, that can also be a stepping stone to being more comfortable to getting themselves help if they need it.
Thank you so much, Dr. Cat, for talking us through about some biggest misconceptions about youth mental health that you've encountered in your work. Thank you so much for talking us through. Um, Tell me something, Dr. Cat, before moving to the last question, because I know you're a very busy person, so I need to be very snappy in this last questions now. Tell me, how do you work with people, youth, young people that are in different? Okay, let me put it this way: how do you work with people that are of different background? People like from like different countries, like not in the US, Americans, like
Yeah.
people maybe from Spain, Spanish people,
Yeah.
Spanish young people, French young people that have a different mentality from
Yeah.
people in the US as well. I know US is a diversified nation as well, but how do you work with people in the young people that are of different ethnic groups? How do you do that?
Yeah, it's an important question because people's identity and their culture does shape the way that they're thinking about healthcare and whether or not they're comfortable engaging in healthcare. So, for us, I'm US based. A lot of my work has been in the US, but as I launched an ambassador program, which is again just a virtual like learning opportunity for young people, we ended up having kids from across 20 different countries who have wanted to join. And we said, well, why not? Like, let's just let them in. It's a global program. We have, different kind of rules and guidelines for young people to just be respectful of each other, to be open to listen to other people about their experiences. So by just, I think, inviting people from all backgrounds into the conversation, we can have a more rich conversation and young people can really learn about, well, what does mental health care mean to me versus what does it mean to somebody else?
Thank you so much, Dr. Kat. I believe the audience will really lighten the more about how you work with people of different cultures and different ethnic groups because not everybody have the same type of mentality as well. There are people that their religion don't suit what kind of works that neuroscientists and all that do. So thank you so much for just talking us through on how you work with them. So Dr. Kat, the last question for you is, yeah, I know that you're an amazing speaker as well. So as an award-winning speaker, how do you use public speaking to drive change in mental health awareness and advocacy? How do you do that?
It's been more and more on my mind. I used to teach at the university as a professor, so I got used to speaking, especially to young people, and then got into some keynote speaking, and really have, as I said, just started to get into social media. But I see social media and public speaking as the very upstream mental health care, the prevention, the first touch point that people are probably going to have is going to be something on social media. Maybe they're curious about something, or they're not feeling well. They're wanting to see, is this right that I'm feeling this way? They're going to go online. They're going to look on social media. They're going to see a talk like this. So I think that there's great promise to these technologies and social media in particular when they're done well, and with like this conversation, healthcare professionals who are being thoughtful about the information they're putting out there. We can really demystify that healthcare process and answer young people's questions about how the system works, or what is it going to be like when I go to this doctor's office, or even do a live stream of a doctor's office and show them what it looks like. And by doing that, I think we're really having more transparency into what does healthcare look like, and reducing anxiety. So that's going to help just increase help seeking and the use of services for those people who need it.
Incredible, incredible. I know that your students are really proud to have you as their teacher because you're an incredible person. So we've come to the end of the session. Thank you so much, Dr. Kat, for your time. You know, Thank you so much for sharing your initiative on this thought provoking questions, for the audience to get more enlightened the more. So if you wanted to connect with Dr. Kat, her details will be on the YouTube description below. Do well to subscribe to her YouTube. She just started,
Just
it
started
just,
a couple weeks
just
ago.
with time. Yeah, with time, she's gonna blow up. It's just a matter of time. So make sure you subscribe to her YouTube. Make sure you follow her up on Instagram, on Twitter, which is X now, and also on LinkedIn as well. Sure, we're gonna put it on the YouTube description below. So thank you so much, Dr. Kat. Thank you, everyone.
Thank you for having me.
Yeah.